Hello everyone and welcome back to a Vital Nursing 101 video. Today we are going to talk about muscle relaxants, specifically cyclobenzaprine and baclofen. You may hear cyclobenzaprine called by the older brand name Flexeril. You may hear baclofen by the brand name Liable. These medications are both considered muscle relaxants, but they are not exactly the same. They are used for different types of muscle problems, and that is a big nursing school point. Cyclobenzaprine is commonly used for short-term muscle spasms, like back spasms after a strain. Baclofen is more commonly used for spasticity, especially related to neurological conditions like multiple sclerosis or spinal cord injury. So today, we are going to break this medication class down step by step. We will talk about why these medications are used, how they work, important side effects, major warnings, nursing responsibilities, lab monitoring, patient teaching, and what findings should be reported to the provider. And throughout the video, I will add pop test questions to help you think like a nurse. Let's start with the basics. Muscle relaxants are medications used to reduce muscle tightness, spasms, or spasticity. Now let's define those terms, because they are not all exactly the same. A muscle spasm is a sudden, involuntary tightening of a muscle. For example, a patient lifts a heavy box, strains their lower back, and now the muscles in the back tighten painfully. That is the type of situation where cyclobenzaprine may be ordered. Spasticity is different. Spasticity is increased muscle tone or stiffness that usually happens because of a problem in the central nervous system. You may see spasticity in patients with multiple sclerosis, spinal cord injury, cerebral palsy, stroke, or other neurological conditions. That is the type of situation where baclofen may be ordered. A simple memory tip is this: cyclobenzaprine for common cramps and baclofen for brain or spinal cord stiffness. That is not a perfect rule for every single order, but it helps nursing students separate the two. Cyclobenzaprine is usually for acute musculoskeletal spasms. Baclofen is often for neurologic spasticity. Pop test question: which medication is more commonly associated with spasticity from multiple sclerosis or spinal cord injury? A. Cyclobenzaprine. B. Baclofen. C. Acetaminophen. D. Diphenhydramine. The correct answer is B. Baclofen is commonly used to reduce spasticity related to neurological conditions. Now let's talk about cyclobenzaprine. Cyclobenzaprine is a centrally acting skeletal muscle relaxant. Centrally acting means it works in the central nervous system, which includes the brain and spinal cord. It does not directly relax the muscle like turning off a switch inside the muscle itself. Instead, it works through the nervous system to reduce muscle hyperactivity. Cyclobenzaprine is usually used along with rest, physical therapy, stretching, heat or ice, and other supportive treatments. That is important. Cyclobenzaprine does not replace physical therapy. It does not heal a strained muscle by itself. It helps reduce painful muscle spasm so the patient can move more comfortably and participate in recovery. For example, a patient comes to urgent care with lower back pain after lifting furniture. The provider may recommend rest, gentle movement, heat, and a short course of cyclobenzaprine at bedtime because the spasms are preventing sleep. Cyclobenzaprine is usually intended for short-term use. Many patients take it for only a few days to a few weeks, depending on the provider's instructions. It is not usually a long-term medication for chronic muscle pain. Memory tip: cyclobenzaprine is for short-term spasms. Pop test question: cyclobenzaprine is commonly used for which situation? A. Acute painful muscle spasms after a strain. B. Bacterial pneumonia. C. High blood sugar. D. Blood clot prevention. The correct answer is A. Cyclobenzaprine is used for acute painful muscle spasms, often along with rest and physical therapy. Now let's talk about baclofen. Baclofen is also a muscle relaxant, but it is especially used for spasticity. Baclofen works on the central nervous system and affects GABA-B receptors. GABA is an inhibitory neurotransmitter. Inhibitory means calming or slowing down nerve activity. So baclofen helps reduce overactive signals that cause muscle stiffness and spasms. A simple memory tip is, baclofen backs down spasticity. Baclofen may be used in patients with multiple sclerosis, spinal cord injury, or other spinal cord conditions that cause muscle stiffness, cramping, and spasms. Baclofen does not cure the underlying neurologic condition, but it may help the patient move more comfortably, participate in physical therapy, sleep better, reduce painful spasms, and improve daily function. Baclofen can be given orally. There is also intrathecal baclofen, which is delivered directly into the spinal fluid through a pump for certain patients with severe spasticity. For this beginner-friendly video, we are mostly focusing on the general nursing concepts, but it is important to know that intrathecal baclofen pumps exist. Intrathecal baclofen has special safety concerns because pump problems or sudden interruption can cause serious withdrawal. Pop test question. Baclofen works partly by affecting which calming neurotransmitter system? A. GABA. B. Insulin. C. Histamine. D. Heparin. The correct answer is A. Baclofen affects GABA-B receptors and helps reduce overactive nerve signaling that contributes to spasticity. Now let's compare cyclobenzaprine and baclofen in simple language. Cyclobenzaprine is often used for acute muscle spasms related to injuries, sprains, strains, or musculoskeletal pain. Baclofen is often used for spasticity related to neurological problems. Cyclobenzaprine is usually short-term. Baclofen may be used longer-term depending on the patient's condition. Cyclobenzaprine can cause drowsiness, dry mouth, dizziness, and anticholinergic side effects. Baclofen can cause drowsiness, dizziness, weakness, fatigue, and serious withdrawal if stopped suddenly. Cyclobenzaprine has some similarities to tricyclic antidepressants in structure, so it has extra cautions, especially with certain heart conditions and serotonin syndrome risk when combined with serotonergic medications. Baclofen requires extra caution in kidney impairment because it is mainly removed through the kidneys. So for nursing school, when comparing the two, remember this. Cyclobenzaprine. Acute spasm. Short-term, sleepy and dry mouth. Baclofen. Neurologic spasticity. Kidney caution. Do not stop suddenly. Pop test question. Which statement is most accurate? A. Cyclobenzaprine and baclofen are always used for the exact same condition. B. Cyclobenzaprine is often used short-term for acute muscle spasm, while baclofen is often used for spasticity. C. Baclofen is an antibiotic. D. Cyclobenzaprine is an opioid. The correct answer is B. Cyclobenzaprine and baclofen are both muscle relaxants, but they are commonly used for different muscle problems. Now let's talk about how muscle relaxants help patients. Muscle spasms and spasticity can affect comfort, movement, sleep, and safety. A patient with a painful back spasm may have trouble walking, bending, sitting, sleeping, or participating in physical therapy. A patient with spasticity may have tight muscles that make it difficult to move the arms or legs, transfer from bed to chair, maintain hygiene, or prevent contractures. A contracture is a permanent shortening or tightening of muscles, tendons, or joints that limits movement. Muscle relaxants can help reduce muscle tightness enough to improve function, but they are not magic medications. They work best as part of a bigger plan. That plan may include physical therapy, stretching, positioning, heat or ice, exercise, assistive devices, and treatment of the underlying condition. As a nurse, you should assess not only pain level, but also function. Can the patient walk better? Can they transfer more safely? Can they sleep? Can they participate in physical therapy? Is the spasm less intense? Is the spasticity interfering less with care? Pain relief is one outcome, but function is also an outcome. Now let's talk about common side effects. The number one side effect to remember for both cyclobenzaprine and baclofen is central nervous system depression. Central nervous system depression means the brain and nervous system slow down. This can cause drowsiness, dizziness, sedation, confusion, weakness, impaired coordination, and falls. This is a major nursing safety issue. A patient may take one of these medications and feel very sleepy. They may stand up too quickly and become dizzy. They may be unsteady walking to the bathroom. They may be at higher risk for falls. This is especially important in older adults, post-op patients, patients using walkers or canes, and patients taking other medications that cause sedation. Memory tip: Muscle relaxants relax more than muscles. They may relax the patient's alertness, balance, and coordination too. Pop test question. Which safety risk is most important with muscle relaxants? A. Falls related to dizziness and sedation. B. Hair color change. C. Increased height. D. Improved vision. The correct answer is A. Muscle relaxants can cause dizziness, drowsiness, weakness, and impaired coordination, increasing fall risk. Now let's talk about cyclobenzaprine side effects in more detail. Cyclobenzaprine commonly causes drowsiness, dizziness, dry mouth, fatigue, and sometimes constipation or blurred vision. Dry mouth, constipation, blurred vision, and urinary retention are anticholinergic effects. Anticholinergic effects happen when a medication blocks acetylcholine activity. You can remember anticholinergic side effects with this simple phrase: dry, blurry, blocked, and confused. Dry mouth, blurry vision, blocked urine or constipation. Confused, especially in older adults. Because cyclobenzaprine can have anticholinergic effects, it can be risky for older adults. Older adults may be more sensitive to confusion, sedation, constipation, urinary retention, and falls. Cyclobenzaprine should also be used cautiously in patients with glaucoma, urinary retention, or certain heart problems. Cyclobenzaprine is related in structure to tricyclic antidepressants, so it may not be appropriate for patients with certain cardiac conduction problems, arrhythmias, recent heart attack, or heart failure, depending on the prescribing information and provider judgment. Another important concern is serotonin syndrome. Serotonin syndrome is a potentially serious condition that can happen when there is too much serotonin activity in the nervous system. Cyclobenzaprine can contribute to this risk when combined with other serotonergic medications. Examples of serotonergic medications may include SSRIs, SNRIs, MAOIs, certain migraine medications called triptans, tramadol, linezolid, and some others. Symptoms of serotonin syndrome can include agitation, confusion, sweating, fever, fast heart rate, high blood pressure, diarrhea, tremor, muscle rigidity, and hyperreflexia. Hyperreflexia means overactive reflexes. This is not common, but it is important to recognize. Pop test question. Cyclobenzaprine can cause anticholinergic effects. Which finding is an example? A. Dry mouth. B. Low potassium only. C. Increased oxygen level. D. Faster wound healing. The correct answer is A. Dry mouth is a common anticholinergic side effect. Now let's talk about baclofen side effects in more detail. Baclofen commonly causes drowsiness, dizziness, weakness, fatigue, nausea, and headache. It can also cause confusion, hypotension, and respiratory depression, especially if taken with other central nervous system depressants. CNS depressants include opioids, benzodiazepines, alcohol, sleep medications, some antihistamines, and some anti-anxiety medications. So if a patient is taking baclofen plus oxycodone plus lorazepam, the nurse should be concerned about sedation and breathing. Baclofen can also worsen weakness. This matters because some patients with spasticity already have mobility problems. The goal is to reduce spasticity, but not make the patient so weak or sedated that mobility becomes worse. Baclofen toxicity is another concern, especially in renal impairment. Because baclofen is mainly removed by the kidneys, decreased kidney function can cause the medication to build up. Baclofen toxicity may cause severe drowsiness, confusion, dizziness, weakness, low muscle tone, respiratory depression, seizures, or coma in severe cases. So with baclofen, always think kidneys and CNS depression. Pop test question. A patient with chronic kidney disease becomes very sedated and confused after baclofen. What should the nurse suspect? A. Possible baclofen accumulation or toxicity. B. Normal expected finding only. C. Improved kidney function. D. Low cholesterol. The correct answer is A. Baclofen is primarily excreted by the kidneys, so impaired renal function can increase toxicity risk. Now let's discuss baclofen withdrawal. This is a major nursing school point. Baclofen should not be stopped suddenly unless the provider determines there is a serious reason. Abrupt withdrawal of baclofen can cause serious symptoms. These may include return of severe spasticity, itching, anxiety, confusion, hallucinations, seizures, fever, muscle rigidity, and in severe cases, life-threatening complications. With intrathecal baclofen pumps, sudden interruption can be especially dangerous. For example, if the pump runs out, malfunctions, or the catheter has a problem, the patient may develop severe withdrawal symptoms. This can look like a medical emergency. Memory tip: back off baclofen slowly. Do not stop it suddenly. Tapering means the dose is gradually reduced over time according to provider instructions. As a nurse, you should teach patients not to stop baclofen on their own. If they are having side effects, they should call the provider. If they use an intrathecal baclofen pump, they must keep refill appointments and report pump alarms or sudden return of symptoms. Pop test question: which medication should not be stopped suddenly because withdrawal may cause hallucinations or seizures? A. Baclofen. B. Acetaminophen. C. Loratadine. D. Calcium carbonate. The correct answer is A. Abrupt baclofen withdrawal can cause serious symptoms including hallucinations and seizures. Now, let's talk about black box warnings and major warnings. Cyclobenzaprine and oral baclofen do not have the same type of classic opioid boxed warning, but they have important warnings nursing students must know. For cyclobenzaprine, major warnings include CNS depression, interaction with alcohol and other CNS depressants, anticholinergic effects, serotonin syndrome risk, and use concerns in certain heart conditions. Cyclobenzaprine should not be used with MAO inhibitors or within 14 days of stopping an MAOI because serious and even fatal reactions have been reported with similar medications. MAOIs are a class of antidepressants that are not as commonly used now, but they still show up in nursing pharmacology. For baclofen, major warnings include CNS depression, additive sedation with alcohol or other CNS depressants, renal impairment risk, and serious withdrawal if stopped abruptly. For intrathecal baclofen, withdrawal can be life-threatening and requires urgent attention. So for nursing students, do not only memorize drowsiness, think deeper. Cyclobenzaprine, drowsiness, dry mouth, serotonin syndrome, heart cautions, MAOI contraindication. Baclofen, drowsiness, weakness, renal caution, withdrawal, pump safety if intrathecal. Now let's talk about nursing responsibilities before giving these medications. First, assess the reason for the medication. Is the patient having acute muscle spasms or chronic spasticity? Is the medication appropriate for the type of muscle problem? Second, assess baseline pain and function. Ask the patient about pain level, location, spasm intensity, tightness, range of motion, ability to move, ability to walk, and ability to sleep. Third, assess sedation and fall risk. Is the patient already sleepy, confused, weak, unsteady? Are they elderly? Do they use assistive devices? Have they fallen recently? Fourth, check vital signs. Pay attention to blood pressure, especially if the patient is at risk for hypotension. Fifth, assess respiratory status if the patient is taking other sedatives or has respiratory disease. This is especially important if the patient is also receiving opioids, benzodiazepines, gabapentin, pregabalin, sleep medications, or alcohol. Sixth, check kidney function for baclofen. Review BUN, creatinine, and estimated glomerular filtration rate if available. Seventh, review the medication list. For cyclobenzaprine, look for serotonergic medications, MAOIs, other sedatives, and medications that increase anticholinergic burden. For baclofen, look for other CNS depressants and medications that may worsen sedation. Eighth, assess allergies and previous reactions. Ninth, for baclofen, ask whether the patient has been taking it regularly. If doses were missed, assess for withdrawal symptoms. If the patient has an intrathecal baclofen pump, assess pump function concerns, refill schedule, and return of spasticity. Pop test question. Before giving baclofen, which lab area is especially important to review? A. Kidney function. B. Blood type only. C. Cholesterol only. D. Pregnancy test for every patient only. The correct answer is A. Baclofen is primarily removed through the kidneys, so renal function is important. Now let's talk about lab monitoring. For cyclobenzaprine, there is no routine drug level that nurses commonly monitor. But depending on the patient, you may monitor vital signs, mental status, fall risk, bowel function, urinary retention, and side effects. If there is concern for overdose or severe reaction, the provider may order cardiac monitoring or other tests, because cyclobenzaprine is related to tricyclic antidepressants. For baclofen, kidney function is very important. Monitor BUN, creatinine, and eGFR. If kidney function worsens, baclofen may accumulate and cause toxicity. Also monitor mental status, sedation level, respiratory status, muscle strength, and spasticity. If the patient has severe weakness, extreme sleepiness, confusion, or slow breathing, report it. There is no common routine baclofen blood level in everyday nursing care. You monitor the patient's clinical response and kidney function. For patients with intrathecal baclofen, monitoring is more specialized. You watch for overdose symptoms and withdrawal symptoms. Overdose may cause extreme drowsiness, dizziness, respiratory depression, seizures, loss of consciousness, or coma. Withdrawal may cause sudden return of spasticity, fever, itching, confusion, hallucinations, muscle rigidity, or seizures. Pop test question. What is the best way for the nurse to monitor effectiveness of a muscle relaxant? A. Assess pain, spasm intensity, mobility, and function. B. Only check hair growth. C. Only check appetite. D. Only check eye color. The correct answer is A. Effectiveness includes decreased pain or spasticity and improved movement or function. Now let's discuss administration tips. Cyclobenzaprine is taken by mouth. It may be ordered several times daily or as an extended release form depending on the prescription. Because it causes drowsiness, some patients may be told to take it in the evening or at bedtime, but always follow the provider's order. Cyclobenzaprine can be taken with or without food. If it upsets the stomach, taking it with food may help. Extended release forms should not be crushed, chewed, or opened unless the product instructions specifically allow it. Baclofen is also commonly taken by mouth. It may be taken with or without food. The dose may be started low and increased slowly. This helps reduce side effects like drowsiness and weakness. Baclofen should be taken consistently as prescribed. Do not suddenly stop taking it. For both medications, teach patients not to drink alcohol. Alcohol can increase sedation, dizziness, impaired judgment, and breathing risk. Teach patients to avoid driving or operating machinery until they know how the medication affects them. Pop test question. Why should patients avoid alcohol with cyclobenzaprine or baclofen? A. Alcohol can increase sedation and dizziness. B. Alcohol makes the medication become an antibiotic. C. Alcohol cures spasms. D. Alcohol prevents dry mouth. The correct answer is A. Alcohol can increase CNS depression, sedation, dizziness, and fall risk. Now let's focus on patient teaching. Teach patients the purpose of the medication. For cyclobenzaprine, you might say, this medication helps reduce painful muscle spasms. It works best when combined with rest, gentle movement, and physical therapy as recommended. For baclofen, you might say, this medication helps reduce muscle stiffness and spasms related to your nerve or spinal cord condition. It may help movement and comfort, but it does not cure the underlying condition. Teach patients that drowsiness and dizziness are common. They should avoid driving, operating machinery, climbing ladders, or doing risky activities until they know how the medication affects them. Teach fall prevention. Stand up slowly. Use handrails. Keep pathways clear. Use nightlights. Ask for help if feeling weak or dizzy. Teach patients not to combine these medications with alcohol, opioids, benzodiazepines, sleep medications, or other sedatives unless the provider says it is safe. Teach cyclobenzaprine patients to report severe confusion, fast or irregular heartbeat, fainting, severe constipation, urinary retention, or symptoms of serotonin syndrome. Symptoms of serotonin syndrome may include agitation, fever, sweating, diarrhea, tremors, muscle stiffness, and fast heart rate. Teach baclofen patients not to stop suddenly. They should call the provider if they want to stop or if they are having side effects. Teach baclofen patients to report severe sleepiness, confusion, slow breathing, extreme weakness, seizures, hallucinations, or sudden return of severe spasticity. Teach patients with kidney disease to tell their provider because baclofen dose may need adjustment. For intrathecal baclofen pump patients, teach them to keep refill appointments and report pump alarms, signs of infection around the pump site, sudden return of spasticity, fever, confusion, or severe drowsiness. Pop test question. Which patient statement shows correct teaching for baclofen? A. I should stop baclofen suddenly when I feel better. B. I should not stop baclofen suddenly without talking to my provider. C. I can drink alcohol freely with baclofen. D. Baclofen cures multiple sclerosis. The correct answer is B. Baclofen should not be stopped suddenly because withdrawal can be serious. Now let's talk about what findings should be reported to the provider. For cyclobenzaprine, report excessive sedation, confusion, falls, fainting, irregular heartbeat, chest pain, severe dizziness, urinary retention, severe constipation, allergic reaction, or symptoms of serotonin syndrome. Report if the patient is taking an MAOI or recently stopped an MAOI. Report if the patient is taking multiple serotonergic medications and develops concerning symptoms like fever, agitation, tremor, diarrhea, or muscle rigidity. Report if the patient has a history of serious heart problems and the provider may not be aware. For baclofen, report excessive sedation, confusion, slow breathing, severe weakness, fainting, seizures, hallucinations, severe dizziness, or signs of overdose. Report worsening renal function. Report sudden return of severe spasticity, especially if the patient is on chronic baclofen or has an intrathecal pump. Report withdrawal symptoms such as hallucinations, seizures, fever, severe muscle rigidity, itching, or confusion. Report if the patient stopped baclofen suddenly. Report falls or unsafe mobility. Report respiratory depression, especially if the patient is taking opioids, benzodiazepines, or other sedatives. Pop test question. A patient taking baclofen suddenly develops hallucinations and seizures after stopping the medication. What should the nurse suspect? A. Possible baclofen withdrawal. B. Normal expected response. C. Improved spasticity. D. Mild dry mouth only. The correct answer is A. Abrupt baclofen withdrawal can cause hallucinations and seizures and requires urgent attention. Now let's walk through a clinical example. You are caring for a 42-year-old patient with acute lower back spasm after lifting a heavy box. The provider orders cyclobenzaprine. Before giving the medication, you assess the patient's pain level, mobility, history of falls, current sedation level, allergies, and medication list. The patient says they also take an antidepressant and sometimes take a sleep medication at night. What should you think? You should think about sedation risk and possible drug interactions. Cyclobenzaprine can cause drowsiness, and sleep medications can increase that effect. Some antidepressants may increase the risk of serotonin syndrome depending on the medication. The nurse should review the medication list carefully and clarify with the provider or pharmacist if needed. After giving cyclobenzaprine, you reassess pain, muscle spasm, sedation level, dizziness, and ability to ambulate safely. If the patient becomes very confused or unsteady, that should be reported. Now let's do a baclofen scenario. You are caring for a 58-year-old patient with multiple sclerosis. The patient takes baclofen for spasticity. They are admitted for dehydration and acute kidney injury. You notice they are increasingly sleepy and confused. Their family says they take baclofen every day at home. What should you think? You should think about baclofen accumulation because kidney function has worsened. Baclofen is mainly removed by the kidneys, so acute kidney injury can increase the risk of toxicity. You should assess respiratory status, sedation level, vital signs, muscle tone, medication timing, and notify the provider. The dose may need to be adjusted or held depending on the provider's decision. Do not ignore new confusion in a patient taking baclofen with kidney problems. Here's another scenario. A patient with an intrathecal baclofen pump says, "My pump has been alarming, and my legs are suddenly very tight again." What should you think? This may be an emergency. Pump alarms and sudden return of spasticity can indicate interruption of baclofen delivery. Baclofen withdrawal from intrathecal therapy can become life-threatening. The nurse should report this immediately and follow facility protocol. Do not assume the patient is just uncomfortable. Sudden withdrawal can progress quickly. Now let's compare muscle relaxants with other pain medications. Acetaminophen helps with pain and fever. NSAIDs help with pain, fever, and inflammation. Opioids treat moderate to severe pain but can cause respiratory depression, sedation, constipation, dependence, and overdose. Gabapentin and pregabalin are often used for nerve pain. Muscle relaxants are different. They are used when muscle spasm or spasticity is part of the problem. For example, if a patient has acute low back spasm, cyclobenzaprine may help. If a patient has spasticity from multiple sclerosis, baclofen may help. But if a patient has chest pain from a heart attack, muscle relaxants are not the treatment. If a patient has infection-related pain, muscle relaxants are not treating the infection. Always match the medication to the problem. Now let's review the nursing school must-know points. Cyclobenzaprine and baclofen are muscle relaxants. Cyclobenzaprine is commonly used short-term for acute painful muscle spasms. Baclofen is commonly used for spasticity, related to neurological conditions such as multiple sclerosis or spinal cord injury. Both can cause drowsiness, dizziness, weakness, confusion, and falls. Both can have additive sedation with alcohol, opioids, benzodiazepines, sleep medications, and other CNS depressants. Cyclobenzaprine can cause anticholinergic effects like dry mouth, constipation, blurred vision, urinary retention, and confusion. Cyclobenzaprine has serotonin syndrome risk when combined with serotonergic medications. Cyclobenzaprine is contraindicated with MAOIs and should not be used within 14 days of stopping an MAOI. Baclofen is mainly removed by the kidneys, so renal function matters. Baclofen should not be stopped suddenly because withdrawal can cause serious symptoms, including hallucinations and seizures. Important nursing assessments include pain, spasm or spasticity level, mobility, sedation level, respiratory status when at risk, fall risk, blood pressure, medication interactions, kidney function for baclofen, and effectiveness. Important patient teaching includes avoiding alcohol, avoiding driving until effects are known, taking the medication exactly as prescribed, using fall precautions, not stopping baclofen suddenly, and reporting serious symptoms early. Memory tip: muscle relaxants relax muscles, but they can also relax alertness and balance. Now let's finish with 5 true or false review questions. Question 1. True or false? Cyclobenzaprine is commonly used short-term for acute painful muscle spasms. The correct answer is true. Rationale: cyclobenzaprine is used to help relieve muscle spasm associated with acute musculoskeletal conditions and is usually used along with rest and physical therapy. Question 2. True or false? Baclofen is commonly used for spasticity related to neurological conditions such as multiple sclerosis or spinal cord injury. The correct answer is true. Rationale: baclofen helps reduce spasms, cramping, and muscle tightness related to neurologic conditions. Question 3. True or false? Drowsiness and dizziness from muscle relaxants can increase fall risk. The correct answer is true. Rationale: cyclobenzaprine and baclofen can cause CNS depression, dizziness, weakness, and impaired coordination, which can increase the risk of falls. Question 4. True or false? Baclofen can be stopped suddenly once the patient feels better. The correct answer is false. Rationale: baclofen should not be stopped suddenly without provider guidance. Abrupt withdrawal can cause serious symptoms, including hallucinations and seizures. Question 5. True or false? Alcohol is safe to combine with muscle relaxants because it reduces side effects. The correct answer is false. Rationale: alcohol can increase central nervous system depression, sedation, dizziness, impaired coordination, and safety risks when combined with muscle relaxants. And that is your beginner-friendly nursing pharmacology review of muscle relaxants, cyclobenzaprine and baclofen. Remember, cyclobenzaprine is often for short-term muscle spasms, and baclofen is often for neurological spasticity. Always think about safety. Watch for drowsiness, dizziness, weakness, falls, confusion, respiratory depression with other sedatives, anticholinergic effects with cyclobenzaprine, kidney concerns with baclofen, and dangerous baclofen withdrawal. As a nurse, your job is not just to give the medication. Your job is to assess the patient, check for risk factors, monitor effectiveness, prevent falls, teach clearly, and report concerning findings early. Thank you for watching, and I'll see you in the next nursing pharmacology lesson.